the fearless leader of DePaul Community Health Centers, Dr. Michael Griffin.
Good morning. Good morning, everyone. I'm just very excited that we're here today. I'm excited to welcome all of you all to our Date with Dad on this Father's Day weekend. So excited to have all of our partners that have come together to actually present this program. And I'm excited about all of our panelists that are here that are doing all of these wonderful, wonderful presentations. I'm a father of 5, and so I really I gravitated to our last panel that we had, especially Dr. Gross, who talked about things that fathers can do with their kids to show them and be an example for so many of them on what we can do, both being, as said, connecting with them on both sides of the spectrum. When he mentioned cooking, if you all were in the last panel, I do most of the cooking at home myself, but also he mentioned watching the Saints games with his kids, and I do that too. So having a son and 4 girls, I can attest to all of these ups and downs of being a father and doing so many things with my wife to share. And so with that, I'm very excited again to have so many of you all come out today. And again, I hope we do this annually and we continue to partner with so many partners and continue to grow. So with that in mind, I want to thank all of you all again for being at the event. It does show a willingness for everyone, for all of you all who are here to come out and learn, be open and receive, and be dedicated to actually creating and being great dads in this community. DePaul Community Health Center, we put the needs of all of our patients first. We have over 50,000 patients. 40% of those patients are male, and so that's from being infant all the way up to seniors. And so we really focus on the care of all of our patients, body, mind, and spirit. And in this I think it's Men's Health Month, we are very excited to sponsor this event. So thank you again for being here. Thank all of our panelists. I'm excited about this next panel that is coming. We have all of these doctors who are up there are experts in what they do, especially Dr. Howard. I have to give her a shout out because she provides great care to me. We won't talk so much about that, but with that, thank you again for being here and enjoy.
All right. Thank you so much, CEO and President of Ascension DePaul Services, Dr. Michael Griffin. Thank you so much. This panel is Navigating Life in Healthcare, the Importance of Equity, Diversity in Research, and Screening. Let me introduce you to our panelists, starting all the way at the end, opposite where I am, Dr. Raymond Strong. Dr. Strong is a Director of Pharmacy for DePaul Community Health Centers, easy for me to say, Dr. Raymond Strong. Next, we have Dr. Krystal Howard. She's the lead nurse practitioner and director of clinical education for DePaul Community Health Centers. And also, we have Dr. Kitani Lemieux. She is Associate Professor of Pharmaceutical Sciences here at Xavier University. Also, she is the co-founder and principal of 7-Star Academy, one of the sponsors of this event. Yeah, let's give a round of applause. So when we talk about equity and diversity in research and screening, this is something that we don't necessarily already know. Dr. Lemieux, we're going to start with you because there's an effort that's been going on called All of Us. And so could you please tell us what All of Us is and why it's important?
So good morning, everyone. So the All of Us research program is actually it's a biomedical research program. It is not a clinical trial. And it is sponsored by the National Institutes of Health in Washington, D.C. The goal of this initiative is to enroll 1 million people that are as diverse as our nation. able-bodied, sick or well, it doesn't matter. They're just asking you to sign up. What's the ask? The ask is for you to complete a series of surveys. There's 6 surveys. You would then have the option to donate your biospecimen, a blood and urine sample, as well as release your electronic health record. What's the goal? The goal of this initiative is to better understand health and wellness and what is defined as underrepresented in biomedical research people. Well, who in the world are they talking about? Most of us in the room. If you're anything but, if you're not a Caucasian male, you are underrepresented in biomedical research. Right now, if you're on any medications, if you're on any kind of pills, devices, most of those instruments or medications have been either they've been tailored to meet the needs of mostly Caucasian men, 40-something-year-old Caucasian men. And that's by definition the scale. How much of a dose of a pill are you taking for hypertension or diabetes? Those metrics were, for the most part, established based on the needs of Caucasian men. So many times you find folks with side effects, they don't respond, it makes them sick. And so how do we then improve wellness for everybody? Because most, if African Americans, other ethnic minority groups, women have traditionally been left out of biomedical research studies. How do we now get information that is tailored to the needs of of everyone else who is not a Caucasian male? And so this initiative is to get enough, where you have enough people, that would be 1 million, where we can look at a large enough group to essentially reestablish the guidelines. It's called the Precision Medicine Initiative. So we're not just looking at of course we're looking at your blood pressure and blood sugar and those metrics that inform health, that's the biology that informs health, but also looking at the environment. Where do you live? Where do you work, play, and pray? So the environment informs your wellness. Also, do you live by the racetrack? Do you live by the ocean or green space? Where do you live? And then thirdly, lifestyle. Most of you in the room, if you were to check, you have either on a Fitbit, you got an Apple Watch, you got an app on your phone that is telling you how many steps, how much water did you drink, all of those things, how much sleep did you have, because we know sleep is a major factor on wellness. So all of this together, it's not one or the other, it's all of the above that inform overall wellness. And so the goal of the All of Us research program is to form this research data set. So at the end of the day, when you give all this information, where is it going? It's going into a cloud that will be accessed by researchers like myself that are actually asking questions about health disparities and health inequities to better understand and to better influence, better identifying new targets for medications, better understanding new strategies for overall health and wellness. That is the goal of the All of Us research program.
So one of the things we hear about a lot of times, and we're starting to hear this more about inequity when it comes to health. You might hear it maybe in a news story, maybe, but we might hear it in conversation. What is an example that an everyday person might experience that they don't realize that all of us is an important component of understanding this? Like, somebody goes to a doctor or something like that. What kind of example might an everyday person experience?
That's a great question. So you hear these terms, health disparities and health inequities, and people kind of toss the terms around. What exactly is it? A health disparity means if African Americans represent some 12 to 13% of the U.S. population, but they represent 40 to 50 to 60% of the disease, whether it's infectious diseases, whether it's infant mortality, whether it's diabetes or heart disease, whatever that is a health disparity, because there's an imbalance. If we're 12% of the population, but we represent 50 or we represent more than that relative to any disease or condition, that is a health disparity. A health inequity is where I make it hard for you to get the care that you need. Well, what do you mean? I make it hard for you. The appointments, most of the scheduled doctor's appointments are during the time when I work. I have a hard time with the bus system if you depend upon the bus to get you there. When I get there, I get treated bad. So I don't want to be bothered with the people because I get talked to badly or get poor service, and those kind of things. So health, the access or your experience with the healthcare system now speaks to health inequities. And so those are two different things. So health disparity speaks to outcomes relative to disease. Health inequities say, do you have a fair shot when you get to the doctor's office? Just your whole experience, from the time you make the appointment to the time you get there to the time you see the provider to follow-up. Do they make it hard for you to get your prescriptions? They give you 30 pills as opposed to 90 pills, and you'll have a hard time getting here. So now it's a gap between the time I can get back to the doctor because my prescription was a 30-day prescription versus a 90-day prescription. It's those kinds of things. My healthcare provider, I have services that come to my home. If I am having a healthcare worker come in, and this is one of the things I'm going through with my mom, who is well in years, and there's she has a home healthcare nurse that comes in twice a week. Well, her appointment's at 2 in the afternoon. They call her at 8 and say, hey, Miss Rosa, we have a change in the appointment, so now we're going to move your appointment up to 9. She says, hey, I can't meet at 9. I have another appointment. They say, well, hey, if you don't take this appointment, we're going to say that you refuse service. And now we're going to terminate your service. That's a health inequity. When I make it hard for you to get access to the care that you need, that is a health inequity. And health inequities is, we're finding health inequities play more a role in health disparities than actually the disease itself. So does everybody understand what I'm saying? So yeah, you sick, but you make me work too hard to go get the care that I need and then be treated with respect and thoughtfulness when I get there. You don't give me the right prescription, Dr. Strong. You don't give me enough pills in my prescription. So you're making me go back and forth too many times when you know I have to pick up the kids and I have to work. All of those are health inequities.
So I want to poll the audience real quick on this, and I want to know if this is anything like this has happened anywhere, because this happened to me. I went to the doctor, regular checkup, they did my blood work, came back, the doctor said, okay, your cholesterol is borderline high. I said, okay, and he said to me, just stop eating so much bacon. And I was like, how you know I eat bacon? Because he didn't know. This was my first visit with this man. Has anybody felt dismissed like that when you have gone to the doctor? Okay, so this is what we're talking about. This is the kind of thing we're talking about. So Dr. Howard, we have a bunch of events that happen around the city, and then there's a free health screening, and people are like, man, they having free health screenings too? Why are they doing so many of these health screenings? Everybody got a health screening. Why do we keep doing so many of them?
So we do a lot of health screenings because, number one, we want you to recognize that your life is valuable and worth living in the healthiest state possible. The other is because we know that if we can identify and detect disease early, then we can get early intervention going, early treatment going, which leads to improved quality outcomes, which leads to extended lives, right? Healthy lives. Healthy individuals make healthy communities, right? And so we are all about improving the lives of those in the community and having those lives that you live in the healthiest states possible. I will also say, to piggyback on some of the wonderful things that you said, because those things were great, I will also say it's very important when you go to your primary care nurse practitioner, physician assistant, whoever you choose to see. It is very important to establish a relationship, right? That is one of the most important things that you can do when you go in. So a lot of people choose not to come in because they've had a bad experience previously. Something, they felt dismissed, they weren't heard. And so one of the things that we try to do is we try to let you know that we hear you. You are a shareholder in the relationship, right? The patient-provider relationship. We have shared decision-making. We're getting information, you're sharing information with me, I'm making recommendations about the information that you have shared, things that you can do to improve your health. But if you don't believe in what I'm saying, if you don't believe, because you know there's social media that says, oh, if you take this pill for blood pressure, your lips is going to swell up or your throat will swell up. Well, sometimes that happens, right? But that is not everyone's experience, and your relationship with your healthcare provider ensures that you will get an individualized treatment plan that meets your needs, that takes into account the fact that you work a 9-to-5 job where you have to punch the clock. So no, you cannot come in every 30 days to the pharmacy. Those are things that I need to find out when I see you so that I can give you a 90-day prescription. I also need to be aware of what medications are on your formulary so I can prescribe the right thing so you're not trying to call back to get a different prescription. So it's a lot of things that go into it, and it takes time and it takes patience, and we build relationships. If we're going to talk about some of the screenings that are very important for you to have, so this is not an exhaustive list of screenings, but screenings that are very important, thinking about the things that we've talked about already today in panel number 1. So blood pressure screening, right? High blood pressure, hypertension. So hypertension occurs when the pressure in the vessels is too high. So we are all very familiar with the 120/80 perfect blood pressure number. The top number, which is the 120, is a reflection of the pressure in the blood vessels when your heart is beating. The bottom number, the 80, if we're going to use that number, is a reflection of the pressure in the vessels between beats. If either of the two numbers is high, you have high blood pressure. So yes, you can have 120/94, that is high blood pressure. You can have 150/70, it is high blood pressure. Both components do not have to be elevated. Why is it important to know if you have high blood pressure? The heart is a muscular organ, okay? If the heart is constant, think about going to the gym and you're lifting weights. Don't you do it in reps and sets because you get tired? Well, your heart cannot afford to get tired, because if it gets tired and stops beating, we are no longer here. So as the heart continues to beat, if it's beating too hard, the arteries harden, and then your risk for a heart attack, stroke, kidney disease, other complications occur. So it is very important to make sure that you know if your blood pressure is high. Additionally, people with high blood pressure often have no symptoms, right? Colloquially, we call hypertension a silent killer, because sometimes there are no symptoms involved with it. You're walking around with it, you're fine, until one day you are not. One of the panelists from discussion 1 mentioned that her husband, at a very young age, in his 40s, died of a massive heart attack. Perhaps he had undiagnosed hypertension. We don't know the situation, but if you don't get screened for blood pressure, you will never know. So who should get screened? Any and everyone over 18. In addition to anyone who has symptoms of high blood pressure, headache, vision changes, blood vessels pop in your eye, nosebleeds, any number of things can be a reflection of an elevated breathing. Another thing, diabetes. Dr. Hebert was talking about eating and healthy lifestyle. Diabetes is when you have too much glucose in your body, sugar, right? And so why does that happen? Well, the pancreas secretes insulin, normally in response to glucose. So sometimes the pancreas either does not make insulin, is not making enough insulin, or the insulin that is being made is not able to be used by the body properly, and so your sugar levels rise. What happens as a result of these high levels of sugar in the body? Well, you can get a bunch of other problems, because diabetes by itself is a cardiovascular disease equivalent, meaning no, you didn't have a heart attack, but because you have diabetes, your risk of having one is 50% higher. You've not had a stroke, but because you have diabetes, your risk of that happening is 50% higher. In addition, when you have diabetes that is undiagnosed and uncontrolled, you're at risk for kidney disease, renal failure. You can potentially wind up on dialysis, vision loss, vision changes, circulatory compromise, and the loss of extremity. So how do you know if you have it? Well, sometimes you'll have symptoms, but sometimes you will not. So if you are overweight, obese, 35 or older, get screened for diabetes. And then there are the cancer screenings. We know that men, particularly because this is a Father's Day event, prostate cancer, colon cancer, very, very common diagnoses in men. Colorectal cancer occurs when you have abnormal cell growth in the digestive tract. We know that most colon cancers start as non-cancerous polyps. So if we can do colonoscopies or other things to screen, we can identify those polyps, remove the polyps, biopsy the polyps, and get early treatment. Likewise for prostate cancer, very common in men, and particularly prostate cancer for African American men, higher incidence of it in men, right, than any other racial ethnic group. Men, when they find out they have prostate cancer, African American men typically have higher Gleason scores, which means they have a more advanced stage of prostate cancer. So it's very important to talk with your primary care provider, get your routine examinations so that you can get these things identified early and get treatment if necessary.
So, Dr. Howard, I have a quick follow-up question. How many times, or can you recall times when, and let's stick with men, who have gotten their screening and they've said, man, I'm so glad I did that screening at that health fair because I had no idea that. How many times have you heard that kind of story?
Plenty of times. So a lot of the new patients that come in, sometimes they have gone to screening events. Sometimes they heard something, they went to just a Walgreens pharmacy, checked their blood pressure, and it was high. Sometimes a friend of theirs had a diagnosis of colon cancer and they came in asymptomatic, no issues, went for a colonoscopy, a polyp was found, it was cancerous, stage 1. So of course their outcome is going to be better. So very often, health fairs, health screenings, but just you taking the initiative to go in the absence of any symptoms. Recognize how important it is for you to have routine examinations. We can walk around all the time and say, oh, I feel great, nothing's wrong with me, I don't have to go. Yes, you do. Because you need to know that everything on the inside is going as well as you feel on the outside.
Mm-hmm. So, Dr. Strong, let me come to you. One of the big issues, and I know this having done communications work with DePaul, one of the big issues that DePaul likes to tackle is sexually transmitted infections. There are partnerships that the community health centers do. First of all, what are sexually transmitted infections, STI, and what are some of the measures for prevention?
Thanks for that question. And, STIs, which is sexually transmitted infections, is a new term. We kind of got fancy, but STI is the new term for STDs. And I know that many of you know what sexually transmitted diseases are. How many of you remember back in 2019 when there was a coronavirus that took over the world and killed millions of people nationwide?
Right.
You remember COVID-19? Well, during COVID-19, we were all told by the federal government to social distance. We all had to stay 6 feet apart. We were told to wear masks. And of course, Dr. Hebert was on television every day telling us to wash our hands. In the middle of the COVID pandemic, we saw a spike in STIs nationwide, which is interesting because we were all supposed to be hunkering down. We were all supposed to be inside because everything was closed, but we weren't because STI rates in the United States skyrocket. And of course, who knows which state was number 1? Overall, Louisiana ranked number 1 in 2022 in sexually transmitted infections. Louisiana ranked number 9 for syphilis, number 3 for gonorrhea, and number 1 for chlamydia. So, in some early reports in 2024 now ranks Louisiana as number 6, but we were number 1 in 2022. But here's the good news. At DePaul Community Health Center, we have screenings and we have testing in place. Just like Dr. Howard mentioned testing, and we test you for blood pressure, we test you for diabetes, but we also test you for STIs, that being gonorrhea, that being chlamydia, that being HIV and AIDS. And along with the testing comes treatment. Through grant programs, we have an STI treatment program where we're able to offer STI treatment and care and also screening at no cost to you. And in the very near future, we are actually creating what we call an STI mobile unit, where we're going to get in a big van, a big bus, almost like a tour bus, and we're going to bring the STI screening and we're going to bring the STI testing and treatment to you in the community. But until then, we definitely offer that at DePaul, and of course, those rates aren't what they used to be. And even now, with HIV and AIDS, before, Louisiana was ranked 3rd as it relates to HIV cases, but now Louisiana is ranked number 6. At DePaul, we have screenings, we have testings, we also have the Ryan White program, where we're able to test you and screen you and put you on the best possible meds to treat you for HIV and AIDS. That's the good news, because at DePaul, we have the best medications. We have the medications that they gave to Magic Johnson. All of our patients are living to 25 and 30 years old, but 25 and 30 years with the disease, rather. But in order for that to happen, appropriate screening and appropriate testing have to take place. Just like what Dr. Lemieux mentioned, as it relates to screening, as it relates to testing and equity, we have the testing for the low socioeconomic population. And eventually we will bring that through our mobile unit out to the community to ensure that we test patients for all of these diseases. By us having the best medication in our clinics and also the best medicine in our pharmacies, we're able to provide the best possible care to our patients. We design a therapy that's unique for all of our patients. Some of our patients like taking oral medicines. We have medicines to treat STIs, medicines to treat HIV and AIDS, where our patients only have to take 1 pill, or maybe 1 pill a day. We also have injectable medications to actually prevent HIV, which we call PrEP medications. And we also have injectable medications to treat HIV. Those medicines are administered once every other month. So the therapies are new, the therapies are novel, the therapies are easy, and we make it easy for patients. All our patients have to do is make an appointment, and even for STIs, usually there's no appointment, because when we're seeing something that's unusual, we just run to the clinic. So we actually have walk-in patients in our STI clinic. And as men, oftentimes we don't go to the doctor until we see blood or until there's a lot of pain. And we want to encourage all of our patients, and we want to get our patients in the clinic quicker, because there are some negative outcomes that are associated with STIs. Patients develop meningitis, patients develop eye issues. For women, women tend to have babies with congenital syphilis, which means that the mom had syphilis the entire time that she was pregnant, and perhaps she didn't know, and now she gives birth to a baby who also has syphilis. Of course, there are treatments for that, but there are a lot of negative outcomes that happen with these babies. As it relates to HIV and AIDS, we have medications where if a male patient has HIV and he impregnates a female patient and she now has HIV, they both can deliver a baby that's HIV negative. So the negative outcomes, the stereotypes, the stigmas, the death sentence that we once saw with HIV no longer exist.
All right. Now we're going to jump into questions in a few minutes. So if you have any questions, feel free, start thinking about what those are. Dr. Lemieux, I want to come back to you, because we're hearing about screenings. We're hearing about some of the unfortunate outcomes that we have when it comes to STIs and that sort of thing. So what are some of the actions that fathers can take to be an active participant in their child's health, especially prevention from diseases or infections?
That's a great question, and as was said by the earlier panel, that Dr. Hebert started off by saying, be present. So that's the number one thing for parents to be present. And I'll speak just to dads, since that's what the question is. We're going to emphasize our dads this weekend. Knowing first of all, and then also engaging with your, with the provider, with the pediatrician. So early childhood care, you're going to primarily deal with a pediatrician. It's important that you are paying attention to what is going on. You're not just there kind of on the phone and let the doctor say or do whatever they're going to do, but you're actively engaged in paying attention. The other thing is the model of medicine has changed. The model of medicine, as my colleague mentioned earlier, is where it's shared decision making. If you're being told a lot of things and not asked things, notice what I said. If you're being told things and not asked things, you need to pay attention, because your provider really should actively engage you with shared decision. That's the new model for medicine, where I'm supposed to ask you, well, Mr. Jones, if I see an elevation in blood pressure, not high elevation, maybe that early borderline blood pressure, Mr. Jones, are you willing to change a little bit of what you eat? Can you manage to lose that 5-10 pounds? Are you willing to get up and go walking for half an hour a day and let go of the sodas, maybe drinking the water, and doing lifestyle modifications as opposed to me just sliding you a prescription to start you on hypertension medication? That's shared decision making. If Mr. Jones and I are having a conversation where he's willing to come back in 30 days or 90 days to see if he was able to modify his lifestyle to improve his health outcomes. That's shared decision making. If you have a provider that's just telling you things, and this is for the dad, when it comes to even your children, when they're not asking you how's the child eating, do they have a balanced diet, are they getting enough sleep, are they actively engaged, are they getting enough time to play, you know, not just on the PlayStation all day, but are they going outside and actually running and jumping and playing like children? That helps them to grow and to develop well. So there should be some engagement. And if you're not getting this engagement, and this is what I like to tell, because this is what I had to do. I had to go home and fire some of my parents' positions. I went home and I fired some of my parents' positions because I didn't like the type of care that they were getting. And my parents are old. Well, my dad is deceased, but my mom, but I did this when he was still here as well. And when you see that there are providers that are not listening to you, they're not asking you questions, they're telling you everything. I need you to do this and go and do that. Come back in this many days and we'll look at it then. That was not a conversation. That was a lot of one-way dictation. And if you have that, I want to free you all up to think that you don't have to stay with a provider all of your life. You have the opportunity and actually the responsibility. If you're not getting quality care, these are the social determinants that we're talking about. When you don't get the respect, where people are asking you, what are your thoughts, or how do you want us to partner in taking care of your health? That's the conversation in the new model of medicine. And if you're not getting it, I would advise the parents even teaching their children early by modeling that for them. If the pediatrician is not engaging with the parent in the way, and even asking the child if they're old enough to be able to respond, how are you doing? What color is this? And what color lollipop, what flavor lollipop do you want? Whatever that is, there should be some engagement with the parent and the child. If there is not a back and forth engagement, it's an opportunity for you to seek other care, because now you're speaking to the social determinants. This is not a one-way street. And now with so many different devices and technology has evolved in such a way where there's a lot of the children are wearing little devices and all these different things where they can actually keep up with steps. So there are ways to engage children to improve the health, ways to engage the parents. And my strong recommendation is that if parents are not feeling like or not benefiting from that exchange with the provider, it's an opportunity to seek another provider, because you want to learn, you don't want to advocate for your child, and also you're teaching your child advocacy for him or herself as well. So you're modeling that for your children very early on. And that is the thing that's for me one of the key takeaways, is that paying attention and making sure you're being heard, and also teaching your children how to advocate for themselves by the parent advocating for, or for the dad advocating for your child.
All right, so we do have Q&A time. We got about 5 minutes for that. Does anybody have any questions for any of our panelists? Don't be shy, don't be shy, don't be shy. Yes, we do have a question in the back. Yeah, Michael.
Okay, so my question isn't for anyone in particular, but I would like to know, with Black people and other people of color being the source of medical experiment and malpractice in the past, what do we do to help build that trust between the two communities again?
That's a great question and a fair one. There is a lot of legitimate mistrust, in particular, and I'll speak to the African American community. From the African American, it's not that we haven't been involved with biomedical research, but we have been exploited by it. And there's a lot of mistrust. There's opportunities to build relationship. But my colleague said it earlier, when you go into your provider's office, it's relationship building. I will tell you what the data says. The data actually tells us is that when you have a provider that looks more like you, your health outcomes improve. That's not what I said, but research actually shows that. If you go to providers that look more like you, then you actually get a better health outcome. My colleague on the earlier panel talked about there's some things we don't have to explain about lived experiences. There's typically the respect piece that's in place. You typically mitigate or reduce health inequities. I'm not saying 100%, but you see a reduction in and you see improved health outcomes when providers look more like you. Now, let me be clear. There's some great providers who are diverse and they take care of everybody. But I want to share this with you. I was at a research conference in October. They showed a heat map of the nation. So think of the U.S., the continental 48, and think of this map. And on this map, all of the states were blue or green that showed a reduction in certain, diseases that we're talking about. And in this instance, they were talking about breast cancer. And I know we're at a men's conference, but the trend and the pattern is the same. And it was blue and green, meaning that either the incidence and mortality had gone down nationwide from coast to coast, north to south, until they got to the Deep South. In the Deep South, that heat map of the United States was red and orange. That meant not only the incidence had gone up, but so had mortality. And what I want to suggest to you is this. We keep talking about social determinants of health. Everything is not, because the medicine in California is the same medicine that Dr. Strong dispenses in his pharmacy. The medicine that they have in New York is the same that Dr. Strong dispenses in his pharmacy. So it's not that the medications are different, but there are certain structural inequity, institutional inequities, rules and laws that exist in the Deep South that have long oppressed people. We don't want to say that out loud because it kind of offends people, but that's what the data tells us. And so we're having this conversation about social determinants of health because it is a data-driven conversation. That's what the evidence tells us. Our job here on this panel is to give you strategies on how you can live your best life, body, mind, and soul. Having this information now to empower you to better engage with your providers, better engage and better advocate for yourself and for your family. Some of us are saying about older parents. That would be my story. Some of us are taking care of little children. Earlier panels talked about having 3 and having small children. And so it's not either or, it's all of the above. So it's giving you strategies on how to care for all of us. And so part of that is paying attention, asking questions, and if you don't feel that you're getting the care that you should be having for yourself or for your loved one, go somewhere else.
All right. We have time for one more question if anyone has any questions. One more. All right.
I do have a question. I'm
Yes.
holding the microphone. I want to know how we can address STI with our teenagers and with our young people, because we're seeing a rise in those numbers where social determinants And we had someone tell us just a few days ago about a story that they had encountered with a young person, that the numbers, the age group is getting younger and younger, whereas the STI numbers are rising. So with them not having STI education and health in school, how do we start to address that with our teenagers, with our young population, to get them a better understanding of how to protect themselves and to take away the stigma of PrEP or as the other medications that could prevent those things from happening, Dr. Strong?
That's a good question, and I definitely appreciate you asking that question. That's a difficult needle to thread. And at DePaul, we now have health centers and health clinics in some of our schools. And we're now seeing some of our teenagers that are HIV positive. And that's a difficult conversation to have with a sophomore or junior in school. And usually when those situations happen, we bring the parents in right away. Of course, we do that at the patient's wish. The law says we can't necessarily just call your mom and share that information. There's legislation that's out there, and I know Councilmember Thomas and Senator Duplessis can speak to that, where as healthcare providers, we're limited in what we can say to some of our younger patients. But where do they get the information from? How do they find someone to talk to? Definitely at DePaul, we have services that are in place to meet those needs. We definitely have all sorts of resources for the parents, for the children. We're about to institute a pastoral care program where we're also able to talk to students, to talk to some of our young people, to allow them to express themselves, to allow them to bring things forward. Many years ago, condoms weren't allowed in schools because there was a thought pattern that if students saw condoms, that would be telling them that it's okay to engage in sex before they're married. That's something that we've sort of gotten over. Some schools still don't want condoms in the schools, but those conversations are always difficult to have. But you have to make a comfortable situation and a comfortable environment to the student where they're able to get information from you. And just like my colleague said, it's always an exchange. As it relates to a pediatrician, even as it relates to a pharmacist, if you're not getting the information that you want, if you feel like you can't have that conversation about STIs or anything with your provider because they may think that you're too young, it may be time to find another health center.
All right, thank you so much. So let's thank our panelists, Dr. Raymond Strong, Dr. Krystal Howard, Dr. Kitani Lemieux. And we're going to take another break, and we're going to take a 5